It's a really good question. I've had a career largely as an academic, first at the NIH for a dozen years in the surgery branch, and then off and on for 35 years now at the University of Pittsburgh, interrupted by a time at GlaxoSmithKline as Vice President of Research and 2 biotechs. And as I left my last biotech, I thought about what was the right next step in my career, and part of it was to give back to the Society for Immunotherapy of Cancer, which had been part of my career for much of the last 40 years. I'm very fortunate to have taken on the role as editor-in-chief for the Journal of Immunotherapy of Cancer. This is our society's journal, the Society for Immunotherapy of Cancer, that was started by Pedro Romero from Lausanne a dozen years ago or so. Now we have the opportunity to be the preeminent journal that crosses over between immunology and oncology, and to hug the sweet spot between those two areas. What are we looking for? We're looking for important advances that allow the field to progress. Certainly novelty, although that in and of itself is not sufficient. There has to be sufficient mechanistic basis of understanding both the cancer biology as well as the host response. The format is one which is designed to be extraordinarily readable, and we do this with our colleagues from the British Medical Journal, who are our publishers. For the cancer clinician who grew up at a time when immunotherapy was relatively unknown, the journal provides access to some of the cutting-edge clinical trials that are going on, many of them early phase trials, but some of them late phase 3 clinical trials. And so they'll find authoritative, interesting, and important content which will help them consider how to best treat their patients. In addition, the Society for Immunotherapy of Cancer has put together authoritative committees who work as a set of cancer clinicians to provide authoritative clinical practice guidelines. Currently, we have 16 different CPGs which serve as curated guidelines for clinicians seeking the best and most current available immunotherapies for patients with cancer. We have a variety of contents in our journal. This includes original research, which is the majority of content. These are typically studies that range from the clinical trials that we discussed earlier, but also fundamental basic research in animal models. It also includes focus on biomarkers, both in murine models as well as in patients. It also includes a series of commentaries on either recent literature appearing in our journal itself or outside of it, as well as authoritative reviews. Cancer is a disorder associated with chronic inflammation in adults. In children, it occurs in utero, and there's very little evidence that primary role for inflammation or for immunology. But in adults, clearly, in virtually all of the major cancer types, including lung, breast, colon, pancreas, prostate, all the epithelial tumors, there's good evidence that the crosstalk between the immune response, particularly the adaptive immune response, and the epithelium represent a dialogue that has gone on for 7 to 10 years before we even recognize that a patient has a cancer. How this is going to be impacted by environmental changes, which change so many different factors, including ambient temperatures in the world, the salinity of our seas, the exposure to ultraviolet radiation, a known carcinogen for patients with the most common cancer, skin cancers, is largely unknown. But I would argue that it's quite likely that we will see dramatic changes over a period not of days, weeks, or months, but over decades, where we will see changes in the incidence of cancer, likely increasing as a consequence of these deleterious changes in our environment. We are confronted now with both the upside of AI helping us to deal with information overload, but unfortunately also a rather dismaying problem where AI can be used as a substitute for good judgment and experience, rather using the statistical means latent in AI to provide and create content. And this occurs all the way up and down the food chain of the editorial process. This includes so-called paper mills that can generate papers from prior content. It includes automated reviews of papers by our reviewers, and problems associated with discerning the critical role of AI in any step of the production of a new set of observations. We are alert to many of these changes through early versions of AI, but as it becomes increasingly sophisticated, we're going to need to rely on BMJ and others to use tools to identify where AI has been used not only for good, but also for bad. BMJ has been upfront about some of the critical issues about how these problems arise and how to circumvent them. We have questionnaires where authors must assert whether they've used AI in the preparation of their papers or not. And we're in the process of working with the publishing house to identify novel strategies to utilize computerized software to identify situations or flag them when AI may have been utilized.